Good morning, everybody. Just like to begin this meeting as usual with some of the disclaimers related to the recording of this meeting. So this meeting is being recorded and will be posted to the HCA ESB 5476 webpage. It is open to public disclosure, so please do not disclose any private or confidential information. For public feedback, there will be 20 minutes designated for public feedback near the beginning of the meeting. Each person who wants to share will have 3 minutes to provide their feedback, and non-committee members will remain muted until it is time for them to share feedback if requested during the public feedback time. If you don't have a chance to provide the feedback that you want to share during the meeting, it can also be submitted via email to hcaesb5476@hca.wa.gov. All right. And with that, we'll go ahead and move into the roll call. So I will say your name and give a few beats before moving on to the next. If you are here, just say present. Michael Langer.
Present.
Amber Leaders. Senator Dingra.
Here, sorry.
Thank you. Senator Braun. Representative Davis.
Good morning.
Good morning. Representative Griffey. Caleb Banta Green.
Awake, present.
Don Julian Saucier.
Good morning.
Good morning. Kiera Fisher. Alexi Orr.
Good morning.
Good morning. Amber Daniel.
Morning.
Good morning. Brandy Flood.
Morning. Good morning.
Good morning. Stormy Howell.
Good morning. Present.
Good morning. Chad Enright.
I'm here.
Great, Chad. John Hayden. Sarah Melfi Klein.
Here.
Good morning. Sherry Candelario.
Present.
Good morning, Sherry. Hallie
Morning.
Birchinall. Teresa Adkison.
Good morning.
Good morning. Sarah Gillard. Donnell Tanksley.
Here.
Good morning. Malika Lamont.
Present.
Good morning. Addie Adwell.
Present.
Thank you. Kevin Ballard.
Good morning.
Good morning. Hunter McKim.
Good morning.
Good morning. Kendall Simmons.
Good morning.
Good morning. Representative Taylor. Representative Mossbrucker. All right, so that wraps up the roll call. We'll move on to agenda item number 2, which I'll hand over to Teresa Adkison to read the committee norms and expectations. And Teresa, would you like me to pull those up, or do you have a copy with you?
I was hoping you could pull it up. I didn't find it in the attachments today.
Michelle, while you're doing that, I think I'd like to do a bit of a welcome for today as well, if I may.
Yeah, absolutely.
So many of you, most of you have, again, contributed a lot to the subcommittees and to Friday's meeting. That was extra time. And then ready for today. And I know I say it each time, but I trying to figure out a way to convey how much I appreciate all that you're working on. And I have just a little quick story that a couple weeks ago now, I attended a wedding, and it was an individual in recovery that had been to some outpatient, some residential treatment, had lived in an Oxford home, had taken advantage of recovery support services, and he was getting married and actually had a child, 2 children, and it was a very happy occasion. At the wedding, the best man in the wedding was another individual in recovery that they had supported each other for the last several years, and he had started a business, and they worked together, and they've got a pretty successful construction business now. And I bring that up because I know there are many, many thousands of stories like that where people are successfully using the services at hand, and it may take a while, but they're finding their way to recovery. I think a lot of what you've been talking about, and we've been talking about in the last 6 months or 12 months, is those folks that haven't been able to make that journey all that successfully. You know, those that haven't been able to either find the services or get what they need out of the services, or even be at the point of wanting to engage in the services. And so we want that for all. I just wanted to share what I thought was a success story today, because I think that's part of the vision here, is we want folks thriving in their communities and in their families and with their individual lives. And so hopefully the story that we'll be telling the legislature is there's great things out there in our state that are working very well, but we need more. We need to bring everybody along of this journey. So that's, I guess, a little bit of the mindset I'd like us to take starting on a positive. And I know many of you have lots and lots of stories this way, but you also have the heartbreaking ones, and that's what we're trying to address. So with that, I think we'll turn it over to, and thank you. Thank you for being here today and staying with us again today. With that, we will turn it over to Teresa and for norms and expectations. Thank you.
Thanks, Michael. Good morning, everybody. I'm Teresa Adkison. The committee norms and expectations. We will assume good, positive intent from everyone. We will consider diversity, equity, inclusion, and tribal impacts in the work we're doing. We will offer the both and as opposed to either or. We will show mutual respect. We will be solution focused when identifying a barrier or systematic problem, offering ideas for potential solutions as well to inspire progress and creativity. We will be fearless and willing to share innovative ideas or dissenting opinions with confidence that they will be heard. We will make a best effort to attend all committee meetings. When attendance isn't possible, we will inform Michelle Martinez.
Great, thank you so much.
Okay, now I believe it is time for public comment. So we will set aside 20 minutes for that activity at this point. So public, you are welcome to make your comments at this time. Go ahead and raise your hand and we will call on you. Again, if you didn't hear, it's time for public comment. We have 20 minutes set aside for that this morning. So if you would like to make a comment, please just raise your hand. I see no hands up.
Yeah, sorry, I'm seeing a few comments in the chat that the agenda wasn't posted to the website, so I apologize for that. It is attached in the calendar invite, so if you have that in your calendar, it's in there, but it may be also helpful if I just pull it up so that folks know what's coming up, what to comment on.
Yeah, if you wouldn't mind, Michelle, you pull that up. Thanks. So we're at item 3 now. We'll be doing another quick overview of the Friday special meeting and taking down any more thoughts around our options for voting. We intend to take a final vote today for the criminal legal response to controlled substances. Talk about plan submission timeline and strategy for reviewing pending recommendations. And then we have some subcommittee recommendations that we want to talk about. Legal advocacy, LGBTQIA housing, and looks like training foster parents of children with SUD. And then we'll wrap things up. All right, Lisa.
Hi, Michael. Is it okay to still take advantage of the public comment period?
Yes.
Okay.
Yeah, I think we're still in that time frame.
Okay, great. I just wanted to, this is Lisa Dugard with the Public Defender Association. I have really appreciated the work of so many people, staffing and associated with SURSAC throughout the last many months. Michael, I thought that your comments allowed a good bridge actually to the agenda topic on criminal legal system recommendations. I think we, those of us whose primary focus has been the enormous population whose behavioral health conditions have been engaged, but not through health systems, rather through the criminal legal system. It's been many of our observation that that is not by accident, that people don't reach those systems of recovery and support, not arbitrarily, but because of system design, because of systemic racism, because of the choice of our wider society to view some people's behavioral health conditions as illness that calls for support and from which people do recover, and other people's, especially when it intersects with trauma-driven behaviors and economic inequality, as criminal behavior from which other people need to be protected. And so it's not by accident that people, the population that was a particular focus of 5476 don't reach these care systems. And I just, as you near the end of your work, wanted to, to ask and to urge that system design, purposeful system design, be engaged to make sure that that population that's historically been routed through the criminal legal system does reach the resources that this committee is recommending. Thank you so much for taking the comment.
Thank you. Any other comments? All right, last call for public comment. All right, Michael, shall we move on? Okay.
Yep. Thanks, Lisa, for your comments as well.
Thank you. Okay, Michelle, if you wouldn't mind bringing up our options again that we discussed on Friday.
Sure, and everyone should have received in the attachment to this meeting or via email earlier this morning to the SURSAC members a revised document of the comments that were received for each of the top 4 pulled options with comments from the 9/9 meeting added in now. So I'll go ahead and pull that up, and then we'll pull up the a document to be used for the actual voting process.
All right, thank you. Brandy, while we're doing that, did you want to jump in?
Yeah, I just had a question. I know once we make this vote, what is the process for if people want to appeal it or challenge it or whatnot? I just, the whole process to get to the vote doesn't feel good at all. I don't think it's centered in all the right things. And so if members of the SURSAC committee don't feel right about the vote, is there any kind of appeal process or challenge process that happens? And is it a real process? Like, is it just a process to go through, or can it actually slow things down, is the question I have.
Blake, you want me to address?
Yeah, please do.
Okay. Brandy, we talked, I don't know, 3, 4, 5 meetings ago now about decision-making within SURSAC, and came to the agreement that 60% would be our threshold of support needed to move something forward. So that's what we'll be working within. Ideally, we'd have consensus, meaning everybody would agree this is the way to go. We will need to move forward with a recommendation, and so we will do that. I think what you've heard from members, legislative members during this process, is that this isn't the only way they get feedback, that they will be, as they contemplate what to do during session time, they'll be asking for feedback and having hearings and such. So I think that we would hope that we would come to some consensus agreement on the recommendation. But if it can't, the way it will be described is, here are the options that were considered. So we'll put the background in the report back, if you will, that here are the things that were considered. Here are the ones that got the top votes. Here's how we got to the final vote. But the report would include the other language as well. So the legislature will be able to see the sort of full thinking, if you will, of the group. And so that's where we are today, is trying to get to a recommendation of at least 60%. And Michelle, if there's any more context to that I missed, please let me know. But
I think that covers it.
Okay.
Excuse me, we had Malika.
I think that the meat of what Brandy was getting at is that there are many of us that have felt like there's something wrong with this process from the very beginning, and there's been zero recourse because HCA, and as Michael has reminded us many times, you are the single state authority, and there hasn't been an opportunity to, it has taken so much work to even get us to a special meeting to be able to discuss the topics that we were supposed to have been discussing for the last year. So it's concerning to me. I'm just going to echo Brandy's concern that it feels like there's not going to be anywhere in this report where it is noted that by multiple parties throughout the whole process, we have been asking to be able to engage in a more meaningful way. And so I'm going to formally ask in front of everyone that that's noted in the report as well, that there have been significant concerns with this process from the very beginning and the way that it has been executed, and that our voices have not been listened to, and that there is no adequate way to be able to seek relief. So any apparent consensus is not genuine.
Michael, you're on mute. You were in a.
Yeah, just
Oh, sorry about that.
I'm not.
You're showing on mute.
Actually thinking about this. No, I'm thinking about this because it's I'm taking it to heart. It's hard to hear that the folks aren't feeling like they're being heard, because we're trying to do just the opposite of that and try to set up processes where members can share their thoughts about what, in this case, the response to possession should be. There's much more that we've been doing this year, as you all know, in terms of trying to get recommendations to enhance our system with new and innovative ideas, therefore the subcommittees on treatment, recovery, and such. But we've tried to give ample time on the possession charge piece because it is so important. And that's one of the first things we have to respond to the legislature 2 is based on the feedback of this group that was identified in its delegation and such. So I think we look at the options, and if there's options that you don't feel like has been put forth as responses to possession, we should hear those. But I'd have to give, the comments some more thought. Believe me, we may have missed the mark for some of you, but we've been trying our best to set up time to hear what your recommendations are. So I'm sorry if that hasn't felt genuine to some of you. Certainly not the intent.
All right, Caleb.
Okay, a couple of things in a different question, but related to that, I will share that on the treatment subcommittee, and I think others as well, but we're certainly trying to be very transparent and forwarding on all of the concerns and considerations, including sort of letters in opposition to some of the recommendations. We're just being very transparent and including all of that, and would certainly like, assuming our recommendations go forward, that information also be forwarded to the legislature and other folks, that they see the nature of those concerns from a transparency perspective and also from an efficiency perspective as they're preparing sort of policy responses, knowing the different angles on this. On a related note, I was not able to be at the meeting where there was the first vote on a criminal legal system. I think you all did, which I very much appreciate, take my suggestion to allow people to vote on multiple recommendations. And I hope that's happening again today. I think it's a way to express that people have, I might prefer felonies, but I'll accept misdemeanors, or I might prefer legalization, but I'd accept criminalization. And I say that because I think it's a way to be transparent, and also it may be the only way to get to a supermajority vote. So I put that out there as well. And I'm not clear on what the voting process is, if that same voting process is planned for today.
Caleb, we will take votes. Folks can vote multiple times. We will keep voting until we get to a 60%. So if we end up getting to the top 2, for example, and we're not quite there yet, then we'll re-vote again and see if we can get there. But again, the options will be in the report. It's just that we'll put the one forth that has at least 60%.
So I do have a question about that. Are you saying that there's, you just did say it, but can you clarify a little bit more so we're not unclear during the process that there will be an initial vote? I'm guessing if there's a 60%, we're done. And if not, you're going to do what? Put forward the top 2 and have people vote on one? What's the process?
That's the process that we've identified, yeah. And hopefully that will work to get us to 60%. Okay.
And a quorum have to vote. So, what if you get to top two options that 40% of people don't like, they just abstain, and then do you have to have a certain number or proportion of the committee voting? So there's the supermajority vote, and then there's the proportion of the committee voting. Now, if they're all present, you have a quorum, then maybe you just take the proportion of those who choose to vote. How does that work?
I'm not sure I followed all that, Caleb, but if we however many members we have, we'll be looking for 60% of the members to vote on an option.
Of the members
and
who are present. Okay.
Yeah. Okay. Rep Davis.
Okay. Yep. Rep Davis.
Good morning, everybody. I just want to respond in brief to Malika's comment and thank Malika for her candor. But I also feel compelled to ensure that not all of the frustration or feelings that the process was too swift, that not all of that frustration, in my opinion, is appropriately directed at the healthcare authority. I just wanted to provide a little bit of context here. So the bill, the legislature's response to the Blake decision 5476 had maybe 15 some odd moving parts. I mean, there was a medications with opioid use disorder in it. There was a host program piece. There was Recovery Navigator. One piece was the SURSAC, but there were, umpteen different pieces that required the healthcare authority to hire somewhere between 10 and 20 new staff that they had to actually put the jobs out for and then hire and then onboard. And people say it takes 18 months to be onboarded to a state agency. I will just take some responsibility here. When after that bill passed, the direction that I gave to the healthcare authority was that priority number one should be rolling out the Recovery Navigator program, because the community was demanding a response to untreated addiction, and so was law enforcement. And the work of the I just want to say that it was not realistic or possible for them to turn on high burner all 15 different pieces of that Blake bill at once. That wasn't feasible. They had to hire staff. They had to, everything I just said. So there had to be some triage and prioritization involved inherently. And I specifically am not saying like I'm all powerful or I get to control what HCA does, but the direction I gave them was focus on R&P, getting services out in the field is the most important, and then seat this committee. And because they couldn't do it all at once. And then when they seated this committee, there had to be a large, transparent statewide recruitment. The legislature, like we always do, asked for 27 different things. We want you to have diversity in geography, diversity in race. We also want you to have one law enforcement and one this and one that. And there was a huge amount of work just to seat the committee and then scheduling. So I just want to offer that there were some real logistical concerns that are actually sincere, that HCA is not a magician. They can't make things happen overnight. And I want to just own my own part. Validate Malika's feelings and the feelings of others. And I think it is good to reflect that, but it's unfair. It doesn't sit well with me to have all of that placed. Some procedural things that were out of their control. I also just want to offer that I do think it would be worthwhile to include in the report something to the effect of that we are taking the vote in September, and the legislature's response to the Blake decision, the flagship piece of that response was this statewide Recovery Navigator program, which is a statewide expansion of LEAD, and that only clicked on in Q2, and in at least one region, it's still not really clicked on in Q3 of 2022. So we're taking a vote when we haven't actually seen the fruits of what we funded. And I will also just say quickly that that's not HCA's fault either, because the way, for anyone who doesn't know, the way state agencies work, when something is due to the legislature, they have all these layers of approval through the governor's office, and they don't make those rules. That's not HCA's rules. So they have all these, internal and then governor and OFM and all that layers of approval. So that's why we're taking the vote in September. So anyway, I really appreciate HCA's incredible efforts here. Nobody's perfect, but I think the work they've done across all of the Blake response has been Herculean, and I also wanted to own my part. So thank you.
Thank you. Senator Dingra?
Thank you. I would also like to echo what Rep. Davis did, because frankly, all of this was set up because of my bill and her bill. And we're here because there was a Supreme Court decision in the middle of session, and we had to react and respond. The original bill that Rep. Davis had that set up all of this required years of planning and then execution. It was a laid out system that would have taken a few years, where people might have had the process that they wanted. But we were forced to do a expedited process because of what the Supreme Court did. So I think it is good to acknowledge all of that it is not just one agency who is responsible for this process. It goes from the Supreme Court to the legislature to the governor agencies. And we're all a part of it. And it's unfortunate that the process is what it is. But I would like to echo the participation of everyone in this group, because I do believe everyone showed up sincerely, honestly, and have been able to express their opinions. I'm pretty sure I've heard them all on this call, and many times it's been stressful and challenging, and but that's what we wanted, is to hear people's honest feedback. And our legislative session starts in January, and if we want meaningful change, or we do want a recommendation, unfortunately, we have to abide by these deadlines because we can't delay the start of legislative session. So I do hear the frustration. I do want to acknowledge it, but I also want to say that it is slightly unfair to put it all on the feet of HCA. We are all here because of decisions the state as a whole has made for decades, and we're still here because of decisions the state has made as a whole in the last few years. So I just want to acknowledge, and I do want to thank HCA for actually being able to execute what was in the bill. There's a lot of stuff in the bill, and it was not an easy task. So I just appreciate the intent that everyone is showing up to do this work. So thank you.
Thank you. Okay, Michelle, what are we looking at here on the screen?
All right, yeah, so during the special meeting that was held on Friday, the 3-hour meeting to focus on the criminal legal response here from subject matter experts, we heard from the ACLU, from Mark Cook, we heard from the Washington Lead Technical Assistance Team about diversion strategies in Washington. We heard from Adam Paliu from the University of Washington with an overview of safe supply models. We heard from Tara Hurst at the Oregon Health Justice Recovery Alliance about the decriminalization success and implementation measures from Oregon Measure 110. And we heard from Deontay Damper about disparity and inequity in criminal legal response to possession. And so this document, which was started at the August 1st SURSAC meeting, was built upon after those presentations at the end of the special meeting on Friday, with additional comments for consideration as we take a look at the different options to be voted on today. So we started this new section that is ideas, frameworks, and policies to explore regardless of the criminal legal response to possession, things that are common that can be integrated into the system that have wide support. So things like harm reduction services, diversion, a safe supply initiative. The specific model would, is to be determined, but notes on safe supply. And then these highlighted portions are the top polled options from the August 1st meeting with the number of votes. So in the first column are the initial comments, and then the second column are the additional comments. And I want to be clear that, the comments are meant to, the highlighted portion is the part that will be voted on, and the comments are for consideration. They're not part of the on. But the comments, if you see a comment in there and you're wondering if that's part of the policy, it's not. It's meant to be considered with as a just as food for thought with that option. So we've got maintain possession of a controlled substance as a misdemeanor with diversion options, which initially received 12 yes votes. And then there's decriminalizing possession of controlled substances and paraphernalia with no civil penalty or fines, which received 9 yes votes. This would also include, and you'll see this in the next, when we're getting ready to vote, but this would also include diversion options for crimes aside from possession, since that would be decriminalized. And Lyle doesn't. And then option 3 is decriminalization of controlled substances and paraphernalia, but becoming a civil penalty punishable by fine or community service or waived with the completion of a health assessment or something to that effect. That received 8 yes votes. And then finally, the 4th option is legalizing possession of controlled substances. And I know that this part was a bit contentious, to create a regulated market. In the meeting on Friday, we did discuss how there's several different models for legalization, and the creation of a regulated market doesn't have to mean a commercialized for-profit market. So I just want to make sure that that part is also clear with that. So that this has been sent out to everyone, I think, earlier this morning. It's attached in the calendar meeting for reference. not sure if we want to go through all of them before voting, or if I should just pull up the voting options.
I guess we
Would
could
anyone-
take,
Yeah.
Michelle, if you wouldn't mind, just, does anybody have any more comments they'd like to make on it for consideration on any four of these options, or for that matter, the safe option as well? Or does anybody have any more comments they want to make? Okay, you want to move forward to Muriel?
Yeah. Okay, so I tried to capture in this screen some of the common elements again that we can explore with any possession response, such as the safe supply, law enforcement assisted diversion and referral options. I just wanted to note that there is a recommendation pending from the OED subcommittee to scale lead AGA RNP. So that's already on its way to you. And also wide-scale investment in behavioral health workforce infrastructure for outreach, treatment, and recovery support services. Also wide-scale investment in harm reduction and low barrier engagement services. So I just want to be clear that these are all things that we can be pursuing as part of the plan, regardless of the specific possession response. And then underneath are the specific possession responses that so far have received the most support. So we'll be limiting the vote to this unless there's any that haven't been captured that need to be considered here. Teresa, I see your hand up.
Thanks, Michelle. I know we've talked about it before, but one more time before we vote, could we express the difference between decriminalization and legalization? Like, what is the main difference in those words that makes these two different recommendation or votes? Does that make sense? You've got one that's decriminalized, no penalties, and one that's legalized. So what is the essence of the difference between those two?
Caleb, go ahead. Did you
I'll
have a response to that question?
I'll take my stab at it in part, and I'm sure my colleagues will correct and clarify. But to me, fundamentally, decriminalization theoretically removes the criminality for the individual person who uses substances, but you still have an illegal market with dangerous drugs. So that's one element in there. But within a legalization market, you have to create a marketplace, a highly regulated marketplace, which are good international examples of how to do, so that both the person themselves is decriminalized, as well as they actually have access to a safer supply of drugs. And I'm excited to hear Malika's enhancement of that description.
Go ahead, Malika.
And to be clear, we're only voting on the simple possession statute. So I just want to be really clear, just to add a little more depth to what's being described here. We're only talking about simple possession at the individual level, not wide scale production of, substances. Decriminalization would make it so that there are no criminal penalties for the individual, and that it would be viewed hopefully more so as a health issue. There's a question by Alexi in the chat that says, which option is the best chance for getting a safer supply? That would be legalization. Legalization is what would create regulated supply for of drugs. And that's one of the things that we've been talking about. But when we're talking about simple possession, we're deciding with these options whether or not there's going to be a misdemeanor as a criminal penalty for someone who has simple possession is the charge that they're facing, or are we going to decriminalize that and say that there's no penalties and that we need to look at this more so as a public health response issue? Or do we say that it's decriminalized, but you still get a fine or other civil penalty? But people need to understand that fines and civil penalties oftentimes turn into criminal cases for people that are not well resourced, and that's most of the people that we're talking about. And then legalization would be to legalize the supply of drugs. So I hope that and it would make it that there would be no criminal penalty and for possession or Lisa put it really well in the in the chat. She said legalization means supply and distribution are no longer illegal. But decriminalization with no penalties, like I said, that means that the person, if they have paraphernalia or drugs on them, it's decriminalized. They don't have a criminal penalty, but they can still get the help that they need though. And I like the way, I just wanted to tell Michelle, I like the way that you made this graphic on here, because the top part demonstrates that all of the things are still working. We're still working on those things. We're just voting on this one, the 1, 2, 3, 4 options at the bottom. Simultaneous action.
Thank you, Malika. Sarah?
Thanks. So I think I could use a little bit of clarification around safe supply and who that would be intended for, because per Rep. Davis's comment, if we're pulling out safe supply in conjunction with legal frameworks, then we're able to address the potentially poisoned supply. But my understanding with safe supply was that that would be for people with a documented opioid use disorder, and not for people who, for example, are just experimenting. And I know that the concern, of course, with legalization that many members and the public have expressed is creating new users of opioids and problematic use from that. But I'm just wondering if we can get a little bit more clarification on safe supply and who that would actually be available to.
Yeah, Sarah, I believe we had some, I don't know if you were on Friday or not, but we had an explanation of what that could look like. I'm not sure we've come to consensus with this group of what it should look like. But we do know that particularly with opioids and fentanyl right now, it's so lethal and so poisonous that something needs to be done, right? We're all here to do something about it. And so some options around that were brought forward. But for this vote, we're voting on those bottom 4 options. And then if this group wants to talk more about safe supply, which I think we do because it was voted number 1 as a strong interest, then I think we need to think about, do we want to get more specific? Do we want to talk about what that might look like for the state of Washington? I don't know if that helps or not, but.
Well, and I think it would impact members' decision maybe on legalization if they knew who that safe supply would be available to, and how regulated the overall drug market would be in Washington state, not just the options for people with a documented substance use disorder. Hopefully that clarifies my question.
Yeah, and again, I don't know that we've come to consensus on that. What I heard Friday was that we could set it up where it is for people who have a documented, a full assessment on substance use disorder. There were some arguments to say we could go further than that. We could make it as low barrier as possible for, to address the need. There are concerns that, if you look from a front end prevention perspective on our continuum, availability of drugs is a really high risk factor. It's a risk factor for substance use amongst young people. And so we've known that for decades now. And so I think there's conversation on both sides, low barrier, we're in a crisis mode right now. We need to do something, as well as how far do we want to go, and then not elevate risk for others that may not participate. So there's a lot of conversation still to have. We heard a lot of it on Friday, but I don't know if we have an answer for you today. I think the model that's brought forward was if you have a documented substance use disorder or opiate use disorder.
Okay, Amber.
Yeah, I was actually going to touch on that. I took some photos of the slides from Friday. I know that 2 of those frameworks that were put forth for safe supply were supervised prescribed which has already been successful for decades and has saved a lot of lives, and the prescribe and take home kind of method. And then we have the actual market method, right? So a couple of those different kinds of methods. But I think that the main way that legalization has been successful has been in a prescriptive manner for, you know, these kinds of substances. And it has been going on for a long time in many places with much success. So I just wanted to throw that out there.
Thank you. And Julian?
Yeah, I just want to, I'm just wondering out loud if this group can propose like a framework to propose. I think legalization is huge. I think it needs to be done right. I don't think it requires, you know, a lot of law changes, a lot of considerations for the federal government, a lot of different things. I'm thinking, can we propose like, you know, further looking into that and going in that direction in a proposal, or I don't know.
Yeah, Julian, I think that I don't mean to be over speaking here, but I think that these four options laid out the way they are give sort of the highest level of the direction the committee wants to go or wants to recommend to the legislature that they go. In any of them, I think there's a lot more to do, right? Once we give this as the general direction we think the state ought to head, there'll be a lot of details behind this. What does this look like? You know, questions came up Friday about amounts. There's a lot of questions all the way to the end when you're talking about now legalization. If we said we believe legalization is the way to go for the state of Washington, there'll be scores and scores of laws and details and things that would have to be addressed to make that happen. And what does that actually look like? So I'm not sure we have time to go through all that level of detail, but I think I'm agreeing with you that if we choose to do that, if legalization is what this committee wants the state to move towards during this next session, there would be a lot more discovery and discussion that need to take place.
All right, thank you. All right, Michelle, anything else we need to know about the graphic we have up here?
I do just want to point out one quick thing. So in the misdemeanor option here, the primary concern about using a misdemeanor had been brought forth from some of our members involved in prosecution, and so there was the concern that as a misdemeanor, the crime lab issue where it takes up to a year to process drugs related to misdemeanor drug crimes, and therefore creates this year-long gap in between the incident and prosecution, and potentially bringing someone into the system to benefit from drug courts and things like that. So this hadn't been discussed via committee, but I'll put an asterisk next to this as something that's not official, but something to consider. To expedite crime lab results, there could be a recommendation for a legislative order to prioritize drug crime, misdemeanor drug crimes at the level of felonies, so that they bridge that that time gap, and folks can get help in a timely manner, as opposed to being prosecuted for things that happened a year ago and then not having that time, potentially receiving treatment and benefiting from a drug court intervention. So that's just something that, again, if I put in an asterisk there, it's not something the committee put forth for consideration officially, but I wanted to address that concern with that recommendation that had been coming up. So when you're looking at that misdemeanor piece, know that something like that could be included if the committee wants to include that as we develop that option, if that's the one we want to go with. Otherwise, I think the others are fairly self-explanatory. I want to make sure everyone knows that there's the decriminalization options also include diversion and referral options for other eligible charges. Because I know diversion was brought up multiple times as important for any of these, and also includes decriminalization of paraphernalia. for the decriminalization options. But if there's no additional questions on those, I think we're ready to vote.
Okay. All right, Michael, just for clarity's sake here, Kayla brought up earlier how, okay, Malika, go ahead, jump in.
So I just want to be really clear though, everything that Michelle just suggested that potentially we would want to have maybe have happen or could be a thing is just as nebulous as figuring out a process around legalization. None of that prioritization around testing of drugs or anything like that is anything that's even remotely in the realm of possibility where we are right now. So I appreciate that it appears that there was a lot of thought put into some ideas about what the system could look like that was just presented to us. But I just want to make it really clear for the group that that was Michelle's thinking on the topic. It is not something that has been formally proposed. It's not something that we're considering at this time. This is just it could maybe work that way kind of situation. So as the system works right now, that person could be looking at a year from now. They would, if a person was caught today, it would take a year and a half from now that they would potentially be prosecuted. So like, I appreciate being aspirational, but I think that we need to be honest as well. We don't have a framework for legalization, and we don't have a framework for what was just an actionable framework for what was just suggested under the misdemeanor option. So I just wanted to throw that out there, that we're making a flat vote, from my understanding, correct, on as things are right now, which one of these do we want? Correct?
Yeah. Yep, that's correct. Thank you, Malika. What I had just talked about with crime labs, that's not something that is guaranteed. The voting for the misdemeanor option would be, in the current system, would you want a misdemeanor? Yeah.
All right, thank you. Michael, just so we're on the same page here about the voting, Caleb had asked the question earlier, can we vote for more than one? So we had said last time, I think we voted for the things that we could either would be our best choice, or we could live with it in some regard, I think, or something like that. There may be more options out here than one that appeal to you. So how many times can we vote in the first round?
I think the first round we can vote for as many as you would support, that you would be comfortable putting forward. If we get to a point where we don't have one clear option that outpaces the others, that's over 60%, then we may come back and have to do the second and third votes and limit the number of votes. But let's try the first one just with vote as often as you want to and see if we can come out with one 60% plus winner. If there's more than two over 60%, and there could be, then we'll vote again and to make sure we're clear about who the top one is and go from there.
All right. Caleb, so
we should probably have all the members raise their hand right now so we can get a count of how many are here.
All right.
So that we know what supermajority would be numbers wise. All right, thank you. So Teresa, Amber, Sarah, Sherry, Kendall, Hunter, Addie, Caleb, Julian. Deontay, I'm going to lower your hand. Technically, you're not a member, though you're very much involved, which is wonderful. Chad, Kevin, Ballard, Malika, Sarah, Senator Dingra, Brandy, John, Senator Braun, Tank, Stormy, and Alexi. I think that's, wait, did I count 20? Is that 21?
This is Sarah. I think you said my name twice. It looks like there's 20 hands up.
Okay, thank you. Can I get a verification that we've got someone else verify that there's 20 hands up.
The count says there's 22.
Yep.
It says guest after some people's names. I don't know if your system is set up, whether those folks are actually members or not.
And Rep. Davis raised a hand late, so.
Oh, okay.
Not to call her out like that.
I'm getting 20. I don't know if you guys are reaching 21 or not. But.
I counted 21 just now.
I count 21 as well. And the
Yep.
computer
right.
says 21 too.
Yep. 21.
All right. Yeah, so we'll need 13 votes for supermajority.
Okay, thanks, folks. Can you everybody put down their hands? Thank you. We go. Still have 3 hands up. Are there questions? Senator Braun. All right, thank you, folks. All right, Michelle, you want to? Brandy, do you have a question? Nope, sorry, my bad. All right, Michelle, you want to read through these, and let's go ahead and take the vote. Again, you can vote in the first round anyway. Vote for anything that may appeal to you.
Sure. So first we'll go ahead and get the votes for misdemeanor. Go ahead and raise your hand. If you would feel comfortable supporting that option. And I'll wait for about 20 seconds per vote to get hands up. All right, beginning final count now. Tank, Sherry, Senator Dingra, Kevin Ballard, Stormy Howell, Chad Enright. So 6 votes for that one. All right, great. Go ahead and lower your hands. Decriminalize possession with no penalties. This is an option you'd be comfortable with. Go ahead, raise your hand. Okay. Someone could count as but I'm sorry, I'm going to wait about 5 more seconds for hands to come up. And Blake, if you could count as I read names, that would be helpful to tally these up. Senator Dingra, Brandy Flood, Amber Daniel, Malika Lamont, Sarah Melfi-Klein, Rep. Davis, Teresa Atkinson, John Hayden, Addie Adwell, Sherry Candelario, Alexi Orr, Stormy Howell, Kendall Simmons, Caleb Bantagreen, Sarah Gillard, Hunter McKim.
Sorry, 16?
16.
All right, go ahead and lower your hands. Move on to the second decriminalization option. So decriminalize possession, but still punishable with fine or other civil penalty. Go ahead and raise your hand if you are comfortable with this option. Okay. Don't see any hands up for that one. So we'll go ahead and move on to the final option, legalization. Go ahead and raise your hand if you are comfortable with this option. All right, we'll wait 10 more seconds. All right, and Blake, if you could help me tally again, that would be wonderful. Teresa Atkinson, Sarah Melfi-Klein, Kendall Simmons, Addie Adwell, Caleb Bantagreen, Malika Lamont, Amber Daniel, Sarah Gillard, Alexi Orr, Brandy Flood, Hunter McKim, and Julian Saucier.
I have 12.
12.
All right. So just a reminder, 13 votes needed for supermajority, and decriminalize with no penalties reached that threshold. Thank you, everyone, for your votes this morning. Yeah.
Okay.
All right, we've got our recommendation.
Okay, can we, Michelle, I want to make sure that we don't have any process questions out there based on what just happened. So we do have one that exceeded 60% when people had a chance to vote for anyone that they wanted. So we're comfortable going forward with that. If folks don't understand that in any way, please let us know now. We'd rather not hear later. So we understand how we got to the 60%.
Julian, go ahead.
I intended to vote for decrim, but I see that I somehow hit the wrong button or something because I didn't hear my name and I was just thinking, okay, but I'll make sure that I'm counting on decriminalize, no penalties.
Oh, okay.
So that move that to 17.
No penalties. Yeah.
And
similar question maybe to others. Did anybody else feel that their vote wasn't counted in any way? Please let us know. Okay.
So Julian, your name was called on legalization. Is that also okay?
Yes.
Okay, great. Thank you. Rep Davis?
Thank you. Just a question, not about the process we just undertook, but about the next steps. And I apologize if I'm preempting where you're going. But I, for one, am hugely supportive of safe supply initiatives. Do we have time in this meeting? I do think it would be important. I don't know if we're going to be voting on the things that are on the upper part of the screen share, but I certainly would love to reflect the enthusiastic group sentiment for safe supply in some fashion.
Yeah, I think, Rep Davis, that the top items were the things that this group has talked about consistently of wanting to have included in some way. And so we can certainly do that. If we want to, there was also questions about safe supply, about what the details of that really meant for the state of Washington. So if we want to have more time on a future agenda to talk that through, we can certainly make that happen in order to give direction again in the report of what this committee would be comfortable doing. I think that's might be what you were asking for. In general, the theme of safe supply was one that, or the issue of safe supply seemed to be one that there was a growing interest in across. So we weren't going to vote on those today, but so I guess what I'm saying is we could put more time on to have more discussion about the 4 items on top, if that's the desire of the committee.
Thanks so much, Michael. Yeah, I'll just speak for Lauren. That would be my desire, because I think it would be a much more meaty recommendation, since we only netted on one legal framework. If we said it's not just decrim, like flying a flag out there by itself, it's actually a quite thoughtful, robust framework that includes LEAD and safe supply and this wider investment in behavioral health. There's a lot of meat to it. It's not the critique that we're just doing decrim plus nothing. We actually have a lot of ideas about what should exist in conjunction with decrim, and those ideas, I think, are listed across the top. And to whatever extent we can bundle that with the legal framework that we are putting forward, I think would be constructive.
Okay, thank you. I believe similar sentiments were shared with me with Senator Dingrath a few months ago too, is, you know, what's the general direction and what comes along with it. So those four we can certainly spend some time with. Also, we'll talk about here in a little bit, you know, the recommendations, programmatic recommendations coming from committees as a plan. You know, how do we want to enhance our system in the state of Washington to meet the needs of more people? Many of those ideas are coming forth. And so the report itself would be inclusive of this direction, those four items to the degree we want to describe them. And then here are some other programmatic ideas that the committee is supportive of. And hopefully those three things together would be the package. So hopefully that made sense. Okay.
Okay.
Blake, I believe.
Yeah.
Thank you all
it
for the
looks like
vote. I'm sorry, one more time, Blake. I just thank you. I know it's hard. I know it's challenging. There's a lot of thinking going into this, and it comes down to a fairly quick vote. But I really appreciate the effort everybody put in and the time you took to learn about the options. So thank you. Go ahead, Blake.
all right, Michelle. I think we're at number 6.
All right, so number 6 on the agenda is the plan submission timeline and the strategy for reviewing pending recommendations. And so, as you know, from the email that was sent out on Thursday with all of the pending recommendations from the subcommittee, there are several, and they continue to come to be developed and processed and ready for SURSAC review. Right now, we have 11 that are ready for review and pending review. Currently scheduled, we only have one more meeting after today. So we have 3 recommendations that will be looked at today's meeting. And then we have the October meeting before that is the final meeting to provide recommendations to HCA for inclusion in the plan that will be submitted by October 11th to LAA. So the obvious issue here is that we have a lot of recommendations to process and very little time. The goal, I think, for everybody is to take a look at all of the pending recommendations and get as many of them as possible, or as many as approved by SURSAC, into the plan in time for the submission to LAA on October 11th. But we do only have this meeting and the meeting on October 3rd currently scheduled to achieve that. So right now, we want to open up discussion to talk about what you all would be willing to do, if anything, to create more time to review those recommendations and get them into the plan in time for the submission by October 11th. So that we could make the October 3rd meeting longer. We could schedule additional meetings between now and October 11th. Or we could talk about a process for reviewing recommendations outside of the meetings. So I know that we're crunched and you already dedicate so much time to this work. And also I know that a lot of these recommendations were very, a lot of work went into them, a lot of thought was put into them, and it would be great to be able to include them in the plan. So just want to open the floor to ideas, or, if you want to just say what you're willing to do in terms of longer meetings, more frequent meetings, doing some review outside of meetings. If we could figure out a plan for getting through these recommendations in time for that submission, that would be wonderful.
Michelle, as people think about your options here, again, extending the meeting in October or adding one beforehand or doing some type of a virtual vote. You mentioned LAA a couple times, and that's sort of inside baseball talk for us. LAA is our legislative affairs within our department, and that's our timeline to get information to them to do what I think Representative Davis and Senator Dinger mentioned earlier about the agency processes, or the governmental processes to get these up to the legislature by the 1st of December. So that's all that is just the next step we have to take to make that move forward. I do see Caleb's hand up. There's probably others too that have thoughts about processing. I will just give one more thought to this, is that we can continue to bring ideas forward, but past this timeline, then they're less likely to get into the report, to get to the legislature this session. And I think with all the thinking and work that's gone into making the recommendations, there's not much of an appetite from the subcommittees to say, oh, go ahead, review ours, and you could put that forth for next session, like the 24 session instead of the 23 session. I think most would like to get their ideas considered for the 23 session. So that's where I think we're at this time point. We knew we were getting there. I think, Caleb, you brought that up earlier. We knew we were going to have a crunch time. This is our crunch time. So we'll listen now of what you would be comfortable doing in terms of processing the remaining recommendations.
So I want to share sort of my perspective and my thoughts around intent, and then we can get to what to actually do about it. But since April, and I've been co-chairing the treatment subcommittee with Alexi, since April, we've been acutely aware of the timeline. And I've always been very vocal and clear, along with staff being present, that our goal was to get our recommendations voted on today, so that there was an opportunity for feedback, for instance, which happened with the initial recommendation, which we appreciated folks taking that under advisement and revising and incorporating that. So this has always been our goal. We've always been explicit this is our goal. So I was quite surprised to see that not all the things are for the vote today. My intent is to allow a process where the committee sees the recommendation, has an opportunity to give feedback. The subcommittee has time to consider that and put it forward for a final vote. So what I'm not comfortable with is waiting to have 7 of the recommendations or whatever's left all presented in a month or 4 weeks, whatever it is, and have a vote there, because there's no chance for a back and forth, which I don't think is a fair process to the larger SURSAC committee that may not have been involved. So then there's what to do. We're all busy. There could be an additional meeting. There could be a process which people review the recommendations and give feedback with some pretty short deadline, like, I don't know, this Friday, so the committee has time, subcommittees have time to work on them, any of that feedback. And then issues that are brought up at the future meeting for vote, they weren't brought up previously, aren't considered, because we need to move forward. So I'm just trying to think about those options. So to me, it seems like try to vote on everything in a month, which I don't think is a fair process or similar to what we talked about or what's happened already. Have an interim meeting, which probably frightens all of us, or figure out some other sort of ad hoc process in the meantime. So that's been my understanding over this whole period of time. And from my perspective, our committee has 2 recommendations. They're both meaty, as I know the others are as well, having looked at them, and just want to make sure that they're given due consideration. Thank you.
What I heard Caleb say there, Michelle, is that whether we do it virtually or do it collectively together, we need to do it fast. We need to do it in the next week to 10 days in order to have time for the committee to return something. Other thoughts? Rep. Davis?
I was just going to offer, I mean, I'm certainly open to, it certainly sounds like we need more time. We need more time. To Caleb's point about more back and forth on the recs, we need more time to the back and forth. You and I just had, Michael, regarding the safe supply and the lead frameworks and kind of the 4 items that were listed at the top. So it would be great to, I'm open to meeting in between. I'm open to extending the meeting on the 3rd of October, but I am supportive of somehow inserting more time for dialogue for the SURSAC.
Doing it together as opposed to virtual emails coming right and left.
Or perhaps both.
Yeah. Okay. Others input? Malika?
I think at this point, it's not realistic to think that we can accomplish everything that we need to accomplish without a combined approach. I think it'll take both email as well as potentially meetings. I can personally commit to, voting by email or electronic, should I say.
Okay. Thank you. In order to really get through it, because again, like we talked about, the safe supply is conceptually being supported by many on the committee, but what that looks like and how we describe it when we put a plan together will take some more discussion. So I wonder, it's just going to take time. So I wonder if we end up doing like a couple hours on those front end items, those top 4 items, make sure that we're all comfortable with what's being proposed. And then we take another, it's probably going to be 2-3 hours to get through the other 6-7 recommendations, I would imagine. Michelle, does that sound right to you? So maybe even like an afternoon, like noon to 5 or something, to get all that done. 1 to 5, noon to 5. Yeah. All right. I think we're leading towards, sending out materials ahead of time, making sure people have an opportunity to read them, and then be prepared with questions, but putting together an in-person meeting. And this is going to be the calendaring wizardry that needs to happen here. As we're talking about this today, we are at the 12th, and it sounds like sometime between the 12th and the 20th, we need to get this meeting in. Does that sound right to those on the call? Like anytime after the 20th, it's going to be hard for the subcommittee to come back, as Caleb mentioned. So, Malika, I see your hand up. Was that from before? Or do you have another question?
I would just ask if we could have a real-time commitment from y'all or from HCA that we'll be able to have business time to review the documents, not that we receive things and then it becomes like a responsibility of having to do it during like weekends and other stuff like that. So I'm just going to ask for that commitment from Healthcare Authority that we get the documents within, enough business days to be able to review it during business days.
Well, today is the 12th. I need to ask Michelle a question here. Michelle, do we feel like we have all the recommendations from the subcommittees now, or are we waiting on subcommittee recommendations still?
There may be subcommittee recommendations that get finalized during September. So we need to put kind of a deadline on any that would be reviewed on the 3rd, and also give SURSAC time to take a first look at them before voting on them, right? So I'm wondering what people think about, we'll send any new recommendations from subcommittees as soon as they pass subcommittee, so that you have them with as much time as possible. Individual review of the recommendations with feedback can go to the co-chairs by the final meeting in September, so that they have time to integrate and create a final version. And then that final version will be sent with at least 48 hours prior to the next meeting, like right after the final subcommittee meeting, so that final version can be the one that is actually voted on, which means that there would be the staggered due dates for sending feedback to the subcommittees. I don't know if that makes sense.
Let me help a little bit here, I think. I'm not sure if I'm helping or confusing it more, Michelle. I'm looking at the date of the 20th, which is next Tuesday. And if we met on that day, on the 20th, then we would have recommendations that have come forth before the 20th on that calendar. To Malika's point, don't send them to her on the 19th and expect that she'll have them by the 20th. So we probably have to have them in by that, send them out by that Thursday or Friday in order to have at least Friday and Monday to look at business days.
Right.
Anything that comes in new from the subcommittees after the 20th would not have that opportunity to be kicked back to the subcommittee. So if they're not voted on as written on early October, there would be no chance of them getting into the report. Does that make sense? Because they wouldn't be able to go back and get back in time. So I think that anything for consideration for the plan this year is going to need to come in prior to the 20th, be looked at on the 20th, and then cleaned up to whatever degree needed to be voted on on our October meeting. Remind us the October meeting date again, please.
That's October 3rd.
3rd. Okay, yeah. So that's about as tight as we can go, I think. Anybody disagree with that? You want to propose it any other time frame? Okay. Let's shoot for the 20th then, and set an agenda that we get to look at those top 4 items that we looked at today, plus whatever we don't get through today as committee recommendations. And I will stop now so you can actually get to the committee recommendations that are on the docket for today. So thank you all. I really, I think we all appreciate your willingness to put more effort in here so we can get as much done for this session as possible. So
we have
Right,
one
Sarah,
more
did
hand
you-
up.
Yeah.
Sarah?
Yeah, thanks.
Sure.
So will we get information, and sorry if maybe you've already gone over this, but as far as, I know that it says in the document titles which committee it's coming out of or which subcommittee, but who the co-chairs are for that subcommittee and what the deadlines are, because I know some meet on Tuesday, I think, and some on Wednesday, and that's a lot to keep track of. So I wonder if that's something that will be communicated as we're getting the versions to kick back to the subcommittees for feedback.
Yeah, I can absolutely provide that information along with the recommendations.
Perfect. Thank you, Michelle.
Okay. So we are ready for review of recommendations. Number 2, legal advocacy. Brianna and Alex, we have on the agenda for that. Brianna or Alex, or says Sherry, possibly April, Amber.
Sorry, so I was trying to, I couldn't remember which
No
one
worries.
was going first, so I was trying to pull up the right one.
Oh, no worries. Okay.
I know Sherry's here to help out. Is it legal advocacy that we're doing first?
Yes.
Okay. I know it was sent out, but I'm going to pop it up on the screen for everyone to get a chance to look at. Can everyone see?
Yep.
Okay. So this recommendation talks about legal advocacy for parents and families, including kinship and foster care families affected by SUD and court cases regarding custody, parenting plans, guardianship, and CPS cases. Now, there are currently a number of resources that are out there, including the First Clinic, the family treatment courts that we have. But this is talking about expanding those resources to all of our counties. Currently, only 19 out of the 39 counties have FTC courts programs. So this is requesting an expansion of those services and updating language for indigent to talk about those who have mental health, substance use, and behavioral health services. Currently, the RCW has mental health kind of part of the RCW, but it talks about involuntary inpatient. And so we would like to open it up by expanding it out to a little bit more than that to cover all kinds of mental health and SUD and co-occurring disorders. There's currently resources for we're talking about dependency cases, and there's currently resources for those in tribal areas, but they don't have them everywhere for the other areas. And so we're just trying to mirror what they're currently doing on the tribal side to all the counties in Washington. And we also have adjustments to family court, because there's currently no laws that allows for representation for parents or guardians regarding parenting plans and dissolution cases, especially those that are affected by SUD, mental health, and behavioral health. We are requesting that the Family Law Board work in conjunction with the Office of the Public Defenders to provide legal representation for primary and non-primary residential parents in parenting plans and custodial cases. There was also part of the recommendation is that that there would also be, because I know it's very difficult for the Office of Public Defenders, they would probably need to open up a whole new area for them to do this, but we were also talking about providing clinics that have court staff or experienced paralegals to connect the community partners and peer navigators for these marginalized communities and those affected by SUD to help prepare them for creating parenting plans and teaching them how to navigate the family law and dependency matters. Our goal is to keep children and parents together and navigate through this realm with those affected by SUD. I know this was a recommendation brought up by Amber Daniels, and it's very important and crucial. I don't know if you had any more that you wanted to add. Here's some concerns and considerations that we had regarding like what the cost would be, because it would be pretty substantial. But again, we thought that even just providing expanding services for the FTCs and then having clinics would really be a step forward.
Yeah, do you mind if I?
Yeah, no, go ahead, please.
Okay. So the main concern here is just that, you know, when someone commits a crime, they're guaranteed a lawyer. But when a child is left without one of their parents, it's because of the fact that that parent can't afford a lawyer. That's wrong. And so I know that the reason why this came out of the Recovery Support Services Committee was because a lot of these parents are in recovery or are aspiring to be in recovery, but because they're not custodial parents, they aren't given the resources that either custodial parents are or even criminals are to access those resources. And that's why it's talking about how there are things that are used against parents, even though the law says that they're not crimes, like living in an RV or a car. Things like housing need to be offered, you know, or worked with. We talk about how specialists aren't given livable wages in the treatment world. Funding is primarily going into legal counsel. There needs to be some form of scale or rubric to determine monetary need for legal representation. We know that. I mean, there are systems in place that we could expand upon, such as family treatment court. It doesn't necessarily have to be the custodial parent that gets an opportunity at that treatment court. That child has two parents. So, and there is language in the which, what is it? The Indian Children Act. How would we pronounce that? I don't want to sound.
So in the tribals have their own.
Right.
Yeah.
So if a parent is considered indigent in tribal court, they're guaranteed a lawyer. So there's a legal precedent for this. I think the main concern is just that, the people that suffer when both parents aren't represented in court are the children. And if anybody's ever gone to court without a lawyer and experienced what that feels like, I know that you know what I'm talking about when I say that you don't get taken seriously, especially when you're uneducated as to how that court's supposed to work, how paperwork has to be done in triplicate, and people have to be served. And I know there are clinics already, such as the Northwest Justice Project. My experience with them was I got sat down with a lawyer who told me a bunch of stuff that I couldn't retain, told me I needed to, what I needed to do, but I didn't get any help walking through that process at all. And I still had to show up in court against my son's dad alone, without support. And I think that the fact that that caused a rift in my relationship with my son for 10 years is proof that the difference that having that legal advocacy can make in a child's life. So I just really want to urge everyone to vote for this recommendation. If you have any questions, now's a good time.
Brandon, did you want to take questions?
Well, I wanted to actually broaden this just a little bit. A couple of the constituencies we're trying to reach are foster parents and people who are involved in kinship care. And I think the other piece that was a big part of the discussion is substance use disorder is a treatable disorder. People are cured, they do move on. And we want to erase the stigma that can occur within families. So, and that's part of the reason we say one parent may have custody, the person in treatment for SUD does not. And we want to support that person who has recovered from SUD within that family situation too, to assure that children have access to both parents.
Thank you, Sherry.
Thank you.
Rep Davis?
Thank you. No question, just a quick comment. I'm particularly delighted to receive this recommendation. From having worked with many people in recovery and people with SUD, I can say that frequently the single greatest source of pain is their being absent from the life of their own children. And it's also the single greatest motivator often for recovery. And having helped someone navigate the family law process in an effort to reunite with a child, it is incredibly complicated. It's also, as we all know, a significant source of trauma for children, the absence of the parent from their life. I mean, and yes, it does cost money, but at the same time, I don't see the recommendations being put forward by the SURSAC as separate entirely or divorced from conversations that are afoot related to the use of opioid settlement dollars. I mean, we are going to have not endless money, but some substantial funds, and need to think about places to park those. A couple other things to note. This type of work now, because of Zoom court, can be done more remotely, which actually significantly increases the time available for counsel to be able to participate in multiple cases and access for rural areas. I would like to see this not necessarily limited or just on family law, because obviously people with SUD have lots of civil legal needs, including landlord-tenant and other related matters, immigration in some cases. I'd also like to see us maximize the use of non-attorneys. That was mentioned, but how can we do this in the domestic violence space, having legal advocates who are non-attorneys help navigate the civil legal processes. So we'd love to see that.
Thank you.
Thank you, Senator Dingra. Sorry.
Thank you. I just wanted to add that this recommendation is actually part of a much broader conversation that people are having in other areas. And I think Rep. Davis kind of alluded to that. There's a lot of conversations around, again, legal right to representation in tenancy issues, legal right for representation for survivors of domestic violence in civil matters. So there is a larger component to this, and I think we just need to be mindful of that, because the fiscal note is going to be, has the potential to be larger because, as people call it, civil Gideon, right? It's the right to counsel for criminal cases. They want a right to counsel in civil cases. So that's the larger context, but note that there are a lot of other groups that are working on similar stuff.
Hey, Brianna, anything else?
No, I appreciate all the comments. I know that there was work around the landlord and tenant and those, we were having part of that discussion while we were discussing this, and so it's just um, for me, it's always continue to echo the concerns that we have, right? If we can echo this in multiple spaces, then we're telling legislature, we're telling the governor, we're telling them that these are the changes we would like to see. So I think it's good that we continue to echo the same concepts and ideas.
All right, thank you. Michelle, is there anything what we'd like to do now with this recommendation?
Did we hear enough feedback for the subcommittee to warrant going back to subcommittee, or is this ready to be voted on right now? Because that's the question.
I mean, I feel like just making those comments in here for the considerations and such from the comments made um by Senator Dinger and Rep. Davis, that we can vote now to move it forward. I think that's where we're at.
Okay, great. Then we will go ahead to move to vote, and this does not need to go back to subcommittee and come back again. So we'll have three options: vote yes to pass to put it into the plan, vote no to not include it, and just based on attendance and who does not vote, we'll have our abstain numbers. All right, so if you are in favor of including this recommendation to the plan, go ahead and raise your hand. Right. I'll wait about 5 more seconds for folks to get their hands up. Again, this is for if you are in favor of adding this recommendation to the plan. All right, and Blake, if you could again help me tally these numbers to accurately track them, that would be wonderful. Yes votes, we've got Teresa Adkison, Julian Saucier, Alexi Orr, Amber Daniel, Sarah Gillard, Rep. Davis, Senator Dingra, Sarah Milphy-Klein, Caleb Bantagreen, Malika Lamont, Sherry Candelario, Addie Adwell, and Hunter McKim. There are any SURSAC members who intended to vote yes for this and I did not call your name, please speak up or raise your hand now.
I think we just got one more. Brandy?
And Brandy fled. Okay.
Okay, that's 14.
Okay. So that does cross our threshold, but let's do the no votes anyway to see who does not support this. So hands down. All right. All right, John, I'm just going to lower your hand real quick and put it back up if you're a no vote. I just want to clear this slate before we move on. So if you want to vote no to not include this in the plan, go ahead and put your hand up now. All right, we'll wait about 5 more seconds. All right, we have one no vote from John Hayden. And now if you want to indicate that, well, never mind, we can figure out who abstained based on attendance and who did not vote in those two. So, all right. Well, that's that. So we had a passing number of votes for this recommendation. Thank you, everybody, for that. And we can go ahead and move on to the second one, which is LGBTQIA housing, also from the Recovery Support Services Subcommittee. Brianna, do you have that handy to pull up? Right.
Okay. So this recommendation came out of the Recovery Support Services again, and this recommendation we were talking about when we were talking about various options for housing. This was the reoccurring idea that kept coming up, and so we really wanted to explore it, and this is a recommendation that we came up with. We invited a number of community members, including Utopia, the Mockingbird Society. I think we had Lambert House there, and we reached out to the others. Some of them weren't able to make it, but we did reach out to the groups listed to participate in this recommendation. So this recommendation is very specific to the LGBTQIA plus community. From the discussion, there seemed to be a lack of inclusive housing with those who are part of the community and who have lived experience. And so we really wanted to make a meaningful recommendation to provide not only a housing policy to be more inclusive of LGBTQIA in current housing areas, but also to include a grant program to provide housing to underserved and rural areas for this population, and with the focus on that these are run by the small organizations like the ones we talked about, who have experience in this area and who can understand, what these individuals are going through, and uh, I lost myself. Incorporating staff and community members to help facilitate these kinds of housing options, and for training and policies to support LGBTQIA inclusive housing. So I don't know. I know Deontay was part of this conversation. I don't know if he's here today and wants to say a few
Yes, and I was
words.
screaming over here, please let me take it home, please.
Yeah, please. Thank you.
Well, yeah, a part of the list on that recommendation, if we can edit that and put Vocal Washington, because we are here and we're participating in this space at the top, please. Thank you. I think that one of the things that really stood out for us throughout the process was as we've had so many different entities that are getting millions of dollars to house our community members that identify as that all diaspora of community. But when we talk about inclusivity, it doesn't happen at a lot of those housing spaces, especially when you look at some of our community members that identify our trans brothers and sisters and non-binary people have to wait 6 or 7 months to get out of jail because spaces like Oxford House don't really practice the inclusivity that they say. So when we talk about this, I thought about a lot of my friends that were homeless or had to stay in the jail another year because as much as Seattle acts as though that we're very progressive in the area, there's a lot of people that don't have enough humility to affirm fully unless there's a grant around. So I'm very happy that HCA and the SURSAC committee is looking at this and hope that we can continue. Because I think that this is one process that'll be ongoing, especially when it comes to inclusivity and advocating for our LGBTQIA community members. This also affects the foster care children that we were talking about earlier as well. And I think that's all I have.
Thank you. I know we were talking about like the training and the current housing operators to be more inclusive, to have the understanding, and not just, gender affirming and diversity training, but like anti-racism, harassment and like no harassment training, cultural competency, like those are huge for this area. And they're not there currently, and it's up to housing operators. Like they have their standards, but we would like to really, from the state perspective, to push forward that these are the things that we would like to see within our community.
Good job.
And those were just also adding, those were really big points that were touched on as needing to be done by experts in those fields, such as from Lambert House and Utopia, also from both staff and leadership, that had the opportunity to vocalize those concerns at our subcommittee meetings addressing this one.
Sue Young from Utopia has been really amazing. If anybody gets a chance to have a conversation, they have lots of ideas for different things regarding this population, and just really incredible conversations. So with that, any questions regarding this recommendation?
All right, Michelle, how would you like to proceed?
So if there are no questions or suggestions for revision to go back to the subcommittee, I think this is another one that we're probably ready to go ahead and vote on. We just want to confirm no questions or suggestions for this one, right? If you do have something to add, go ahead and raise your hand. Sorry, Brianna, were you about to say something?
Yeah. I got a message talking about the terminology of cultural competency to cultural humility. Is that something everybody's okay with doing?
Absolutely.
Okay.
No, sorry.
I just wanted to make sure.
100%.
Is this good to vote on?
Sounds like it. If there's any objections to going ahead and voting on this, please raise your hand now. Otherwise, we'll go ahead and move forward with vote.
Hey, Caleb, real quick before we do that, do you want to talk about what you mentioned in the chat there?
Yeah, I thought that we had a voting option of yes with changes, and no, and I didn't hear last time the yes with changes, and I don't know if that's why we didn't have everybody vote or what, but I think that you wanted that as an option, Michelle.
Yeah, the process from last time, was yes with changes to go back to the subcommittee, but there weren't changes that needed subcommittee revision for the recommendation we had just looked at. So that wasn't an option for that one. It sounded like the changes were minimal and they were just immediately integrated. So if there are changes to this one that would require going back to the subcommittee, then we would include that option. So that's what I was trying to figure out, is if there are substantial changes that would be different than this version.
So that's important to know, right? So that's not how we voted last time. I mean, I get your reasoning, but what I'm hearing you saying is we're not going to have the option of a yes with changes unless someone says something or puts something in the chat. And if that's the case, I just think the committee should know that somebody might have some changes they're not comfortable sharing and might want to share it in some other format. Hopefully not, but I just think that should be made explicit because I expected that to be a voting option.
Oh, okay. Yeah, thank you. Thank you for that clarification. So if you have any changes that you want extra time to submit to the subcommittee for consideration for this recommendation, please go ahead and raise your hand. You don't have to explain what those changes are, but we'll allow time for you to provide those to the subcommittee co-chairs for revisions. Okay, great. So Kevin, it sounds like you have some changes you'd like to submit. So we'll go ahead and do the vote with those three options then, to pass as it is, to allow time for changes and then vote, and then the no vote.
Michelle, this is Michael. I'm not sure I understand. So if we're voting, they're voting on as it is, voting on as is with changes. But if we don't know what those changes are now, how are they voting? Whether they would want to have the changes?
Yeah, the voting with changes is a vote to pause the vote essentially right now to allow it to go back to subcommittee, provide feedback to the co-chairs, and then bring it back. Yeah. So essentially, yes, pass it the way it is now. Hold off on voting to allow time for changes and a new version to be presented, or just no.
Got it. Thank you. That helps.
Yeah. Yeah. Sorry about that confusion. So if you are in favor of including this recommendation as it is, go ahead and raise your hand right now. Okay. All right, Blake, if you can help me tally as I read the names, please. Yes votes for passing it as it is: Caleb Bantagreen, Senator Dingra, Addie Adwell, Alexi Orr, Rep. Davis, Danelle Tanksley, Malika Lamont, Amber Daniel, Sarah Melfi-Klein, Hunter McKim, Sarah Gillard, Brandy Flood, Sherry Candelario, John Hayden, Stormy Howell, Teresa Atkinson.
That was 16.
And Julian Saucier.
17.
Okay. Great. And if you would like to vote to hold off and wait till there's changes, have time to submit for changes and improvements to this recommendation, I'll wait for all the hands to clear first. All right, so the second option is to vote to wait and have time to submit revisions, edits, suggestions for improvement to the recommendation and vote on it at the next opportunity. Go ahead and raise your hand now. All right, so one vote for that option. Kevin Ballard. Thank you. And for those that do not want to include this, do not want to put this into the plan, go ahead and raise your hand now. Okay, so 0 votes for that option. All right, since it reached supermajority without revisions, I think we're good to go ahead and move that one forward into the plan. And we had scheduled for a third recommendation review today. We do not have time, I don't think, to do that unless we want to begin it with the last 5 minutes here. for training foster parents of children with SUD. So Michael, I'll defer to you. Do you want to get started on that, or should we begin to wrap things up?
I think we need to wrap up. We got a hard stop at 11, so. I do think thank you. I guess that's it needs to keep being stated time and time again. I am looking on the 20th though, and wonder if we should just do a real quick poll about morning or afternoon. And I'm inclined to say afternoon, but I'd better get a poll. I know we may not get everybody on the 20th, but can we do that real quick in the last couple minutes? Let's just get a general sense of how many folks could do morning versus afternoon.
There is a treatment subcommittee meeting in the afternoon on that day.
Well, that might have to be adjusted if we're going to try to get stuff to this committee before then, right? I mean, we said we wanted the recommendations in by before the 20th in order to discuss them. And so having that meeting on the 20th probably, unless they want to talk about things that would happen for next year.
Michael, I'd put a note in like a half hour ago saying we do meet in the afternoon. I would prefer to meet in the morning so we have time to consider that afternoon.
Okay. All right. That wouldn't meet Malika's interest of having a day or two of, time to review beforehand. But if the committee's okay with bringing things forth and just taking a little extra time to explain them that afternoon, then we could do that.
So for the people who can't make it, will there be a choice? Well, not a choice, but an option maybe to send in a comment or two about the information? Because I know for sure on the 20th in the afternoon, I won't be there, so I can't speak for others, but just at least if we had some type of option to communicate.
Yeah, Tank, I think that I want to say yes. I'm looking at Michelle. It's probably a little unfair for me to say yes without consulting with her, but if we get the materials out ahead of time and you have comments that you want to have shared, then that makes sense to me. If there's a group that's meeting in that morning and then they want to bring forth an idea for the afternoon, there wouldn't be time to get that to you ahead of time. So that would be the only sort of clog in the wheel that I can see.
My thought was that we have the materials for 11 recommendations. And I thought that the intent of the next meeting was to have an opportunity to quickly review them so people have an opportunity to give feedback and understand them and give any feedback if the subcommittees need to review them. Not that we're necessarily bringing up new ones.
Well, anything to be considered for the plan will need to come forth to have at least one look at on the 20th based on what was said earlier, so that we can give time to give feedback to the subcommittees. So it can be newer ones that come in between now and then if there's committee work happening. I'm not sure we cut the spigot off with only what's in right now, but what the committee's asked for is have a little time to look at them before the 20th if we can. If you can't make it, give written feedback, and then that would go back to the subcommittee if needed, and then they come back in on the 3rd for final vote.
So the intent of the next meeting would be to have quick discussions about each of the recommendations, probably like rapid fire presentations, questions, and just have a little opportunity for discussion so that subcommittees can take that in advisement for a final vote in October.
If needed, Caleb, I mean, a few might sail right through, right? There may not need to be a change. That, we want apple pie and everybody wants apple pie. We can just do apple pie right there and then be done. We don't need to come back on the 3rd again, I don't think.
But it's super important. Is the meeting next time just to discuss the proposals or is it to vote?
I would think it could be both. If we're going to spend that time, just like we just did, if it sails through and there's not any changes, then they could add it too. If there's changes, then it gives time for the subcommittees to make those changes and bring back on that 3rd.
And people could vote in email if they cannot make it beforehand, so you have that in hand.
We're at 11 o'clock, and so we need to go back and look at our the charter of what we said about voting electronically. But I know there's several that have hard stop at 11. So I'm not avoiding the question. I just don't know the answer offhand, and I want to make sure we research it so we give the right answer to that. But we'll send out the process. So for those of you that need to go, thank you. Again, it's 11:01. Thank you for committing this 2 hours. Thank you for agreeing to come to some more time if you can. And we'll get a few more meetings on here to get through this by October. So thank you all. Take care.
Thanks, everybody.